I am Dr. Sandeep Madaan, and I am again with you guys for a demo lecture. And today's we are going to discuss about general embryology, right? So let us begin today's class. The story of general embryology, it begins with the primordial germ cells, and we need to know the primordial germ cells. They take origin from which layer? The primordial germ cells, they originate in the second week from the epiblast, right? So let me show you the epiblast. So here we have, you see this part, the primordial germ cells, when they take origin from the epiblast, they start, eventually they have to reach the developing gonads. Why they want to reach the developing gonads? Because that is their target organ, isn't it? So on their way, first they will reach the wall of yolk sac. So in the third week, this is the yolk sac. And in the yolk sac, when you look at the wall of the yolk sac, you can see the red dots. These dots are nothing but the primordial germ cells, right? Now, why this is important? Because in the third week, whenever we take a section in the wall of yolk sac, we always see that there are primordial germ cells. So previously, it was thought that this primordial germ cells, they take origin from the wall of yolk sac itself. That means, as we know, the yolk sac is endoderm. So it was previously thought to be endodermal in origin. But later it was established that the primordial germ cells are actually taking origin from the epiblast and are migrating through the yolk sac, not taking origin there. And in the very next exam, this was asked in All India. That time it was not NEET, that time it was All India exam. So it was asked that what is the source of primordial germ cells. So first thing that we all agree that we need to be updated. Whatever update comes in like any subject, okay? So there are there are very high chances of it being asked in the next exam, right? Be it the central exam or the NEET exam. So now this is the third week and the primordial germ cells, they have reached the wall of, in the wall of yolk sac. Then they will keep on migrating and they want to eventually reach the developing gonads. Here we can see these are the gonads and the primordial germ cells, they are eventually reaching here. And by fifth week, they will reach there and then they are eventually invested, they are incorporated into the developing gonads. Okay. Now this is something very important to understand. These cells will be taken care of by the gonads, and the gonads which are till now indifferent gonads will be converted into male or female depending upon the information brought by the incoming cells. Are you understanding? So both primordial germ cells and the gonads are interdependent. Okay, let me repeat this part. I told you that the primordial germ cells which have reached in the developing gonads will reside here and they will become the part of the gonads now onward, and the gonads till now which were indifferent, that means they were neither male or female, we could not differentiate, so these are called as indifferent gonad, will now be converted into either male or female gonad depending upon the information brought by the incoming cells. Is that okay? Yes. Now if it is XY or XX, it all depends on the incoming cells, right? Now let us write down a flow chart about this. So basically what we are discussing here is so we started with the gametogenesis. All right. And we started with the story of primordial germ cells which take origin from the epiblast. So we have the epiblast which makes primordial germ cells. In the second week, okay, and now primordial germ cells, they will start migrating. These cells will reach the yolk sac these cells will reach the yolk sac, okay, and then after yolk sac, these are going to reach the developing gonad. These are going to reach the developing gonad. Is that okay? Till now story is clear to everyone, right? Now once they have reached the developing gonad, nothing changes but their name. That means now we will no longer call them as primordial germ cells. Rather, depending on male or female, we will call them as Spermatogonia or Oogonia respectively, right? So in the developing gonad, once they have reached, now their story depends on whether they are into male or female, right? In case of male, these are called as Spermatogonia. And in case of female, these are called as Oogonia. All right. Now what are we going to do? We are going to look at the processes of spermatogenesis and the oogenesis. First we will look at the spermatogenesis process and we look at the steps involved in the spermatogenesis. Then we will be looking at the steps involved in the oogenesis and we will compare the processes. What are the similarities? What are the differences between the two processes? All right. Now let us begin with the spermatogenesis. So you see now we have spermatogonia. Okay, and these spermatogonia, first they will increase the number, okay, by undergoing mitosis. So they will increase the number, okay, they'll keep on undergoing mitosis, increasing the number, increasing the number. Then these cells which are newly formed cells, out of these few will again again going to make the spermatogonia, but few will become ready for the next division and then they will become the primary spermatocyte. Now from these cells, some cells will become primary spermatocyte. These are primary spermatocyte. Okay. Now primary spermatocyte will enter into meiosis 1. And at the end of meiosis 1, we are going to get the secondary spermatocyte. Now let me ask you, meiosis 1 is equal division or reduction division? What is your take on it? Yes, please answer. Meiosis 1 is equal division or reduction division? Yes, correct. Meiosis 1 is reduction division. So if it is reduction division, now the secondary spermatocyte which is formed here is haploid. Can I write haploid? Yes. That means primary spermatocyte was diploid. Yes. Can I write it? And spermatogonia was also diploid. So the cells were diploid. After meiosis 1 only they became haploid. Is that fine? Yes. Very good. Now this primary to secondary, this stage basically when the stage changes from primary to secondary, this is called as stage of independent assortment of chromosome. Independent assortment of chromosomes. This has been asked previously. This is a question, which stage is the stage of independent assortment of chromosome? the primary to secondary spermatocyte. Fine. Now this secondary spermatocyte, which is already haploid in the, number, it will undergo meiosis 2. It will undergo meiosis 2. And the spermatids are formed. And the spermatid, these are formed. Fine. Now my question is, meiosis 1 was meant to make the diploid cell into haploid. Yes. And what do we want? We want a haploid number. Now we wanted haploid number and that number has been achieved even in the primary spermatocyte. Then what was the need for meiosis 2 to occur? Why there is meiosis 2 when already haploid number has been achieved? That is what we required, isn't it? So can you please tell me what is the role of meiosis 2? Yes. Answer everyone. What is the role of meiosis 2? See, remember meiosis 1 always takes care of number of chromosomes. Okay. Number of chromosomes, it will depend on the meiosis 1, whereas meiosis 2 deals with amount of DNA. Amount of DNA. Okay. In single chromosomes, if they are dividing, the chromatid becomes double. So the amount of DNA was double. Okay. So as to reduce that double amount into normal amount, meiosis 2 is required. So remember simply, the meiosis 1 is for number of chromosome and meiosis 2 is for amount of DNA. Yes. Is that clear? Can we proceed? Right. Now that we have got spermatid, it will be converted into spermatozoa. It will be converted into spermatozoa. Now spermatid is a round structure. Spermatid is a round structure and spermatozoa is like elongated structure, just like a rocket. So basically now the spermatid is getting converted into spermatozoa. It is basically the step is called as spermiogenesis. The step is called as spermiogenesis. All right. And what happens in this step? There is change in shape, as we have understood. From the round cell it becomes like rocket-like shape of the spermatozoa. That's fine. And the second important change here, what is happening is the rearrangement of the cell organelles. Rearrangement of the cell organelles. And what is that? Like nucleus of the cell will become the head of spermatozoa. Okay. The centriole, one of the centriole will make the neck and the other will make the tail. Okay. Other will make the tail. And the middle piece is made by the mitochondria. Mitochondria is going to make the middle piece. They arrange in the form of spiral and they will make the middle piece. And the Golgi bodies are going to make the acrosome. With all their enzymes, Golgi bodies are going to make the acrosome. Yes, is that fine? Have you understood? So nucleus of the cell is the important thing that comes in the foremost part of the spermatozoa, that head part, and which is again having a cap of the acrosome, and acrosomal cap is nothing but made by the Golgi bodies. The centriole, one of the centriole remains in the neck, and the important structure that centriole is going to make is the tail. Okay, and the spiral mitochondria is going to make the middle piece of the spermatozoa. Is that fine? Yes. So let us understand. Let us look at the diagram where this is all happening. All right. Till now everything is clear? Yes, so we have seen the cells which have reached the developing gonads here. In this diagram we can see the enlarged picture. This is the developing gonads and the incoming primordial germ cells. And now onward, primordial germ cells will be called as Spermatogonia or Oogonia. And we started with the spermatogenesis process. See, this is where the spermatogenesis is taking place. So this is the testes. Inside the testes, if we take a section, we come to know about the seminiferous tubules. So we have so many seminiferous tubules are there. Yes. Now, if we take the look in the seminiferous tubule, that means if we take a section in the seminiferous tubule, we come to know that it has a wall and a lumen, isn't it? This tubule has got a wall and the lumen. Now, if we take this much section and enlarge it, then we will come to know about this view. This is the view here, right? Here we can see this is the wall of the seminiferous tubule and this is the lumen of the seminiferous tubule, right? And all the stages, that is spermatogonia, then primary spermatocytes, secondary spermatocytes, spermatid, this everything is happening in the wall of a seminiferous tubule. So what is the site of seminiferous tubule? The site of seminiferous tubule is the wall of the site of spermatogenesis is the wall of seminiferous tubule, right? The site of spermatogenesis is the wall of seminiferous tubules, right? Now, once the spermatozoa are formed, they are released into the lumen. This release has got a name. What is the name of this release? This process is called as spermiation. I hope everything is clear to you. Yes. In the chat box, please give me a quick feedback. Is everything clear up to this? I wanted to show you the wall and the lumen. Right now the spermatozoa which is formed, it is attached to the wall because all the cell types were there. And now spermatozoa will be released into the lumen. It is released into the lumen. Lumen of what? Lumen of seminiferous tubule. Okay, released into lumen. And this step is called as spermiation. Is that fine? Yes. Now, after this release, these cells, they want to go to epididymis. Let me ask you one question here. Whether the spermatozoa are motile structure or non-motile structure, whether these cells, the spermatozoa, are motile or immotile. Yes, can you tell whether these are motile or immotile? So eventually spermatozoa has to be motile, because if you look at when we do for the semen analysis, what are the important criteria? The morphology is there, motility is there, right? So among all other features, we do have the count of the spermatozoa, morphology of the spermatozoa, and the motility of the spermatozoa. Other factors are also there. Yes, motility is one very important factor. But although spermatozoa are motile, they are just formed. Right now, they are not mature enough. Okay. So basically now they will be carried by the muscular movement of the tubes. Okay. So they are already in the tubules. So from the seminiferous tubules, they will be carried to the epididymis. Why? Two reasons are there. One, they will be stored there. So first thing, storage. Second, they will gain the maturity. So the second part is maturation. So they are taken to epididymis for storage and maturation, right? Let us write down. So now they are taken to epididymis for storage and maturation. All right. So if the question is asked, the spermatozoa attains maturity in, answer straightforward, epididymis, right? Okay. Now let me ask you, although we are saying that these spermatozoa are mature enough, okay, in the epididymis. Yes, they have gained the primary maturity, or you can say they are almost mature. Yes, we can say that. But are they mature enough to carry out fertilization? No, they are not mature enough to carry out fertilization. That means they lack the last step of maturity. The last step of maturity that will give them the capacity to fertilize. What should be the name of the step? Very good. Capacitation. Capacitation is the final step of maturity of the spermatozoa, which gives them the capacity to fertilize. And where does this take place? The capacitation takes place in female genital tract. Very good, very good. So let us write down this information as well in our notes. Okay. So the final step of maturity, capacitation, which will give them the capacity to fertilization, is it will take place. Capacitation takes place in female genital tract. In female genital tract. Is that okay? Yes. Now, capacitation takes place, it will begin from the vagina itself. But if you look at the female genital tract, in the female genital tract, different parts are there. Vagina is there, cervix is there, uterus body is there, fallopian tube is there. Now, out of these parts, which will contribute most? The next question. See, we are going in a sequence, and sequentially you are getting the questions. I hope you are understanding it, right, in a storyline. So the next question in line is, which part of the female genital tract contributes most? Answer, fallopian tube. Okay, although least expected, but fallopian tube is the one which contributes most. Okay, so if you have to choose one, go with the fallopian tube. Otherwise, female genital tract overall is responsible for the capacitation. Is that okay? Yes. Now, what is the time required for capacitation? What is the time required for capacitation? Six to 8 hours, and specific or average we take 7 hours. All right, 6 to 8 hours, or time required we take average as 7 hours. Is that fine? All right. Okay. Now the time required for capacitation is clear, but what is the time required overall for the first step to the spermatozoa formation? That means if I ask you what is the time required for the spermatogenesis, the full process, what should be your answer? The time required for spermatogenesis. Time required for spermatogenesis is 74 days. So around 2.5 months. Okay, so 74 days is time required for the complete cycle, but it keeps on, like, it is happening on daily basis. All right, so this is how it happens. This is how it happens. So this is all important. This is all important stuff for you, the spermatogenesis. All right. Now that we have seen, let me show you the diagram, and let us look at the diagram again. Okay, and look at the flow chart. Yes. See, here what is happening, we can see the spermatozoa are being released here from the lumen. These are the different stages. What is happening? Spermatogonia to site, and then to spermatid, then to spermatozoa. Finally, the spermatozoa are released into the lumen. Fine. And these are the steps which is given in the Langman. You can see here the spermatozoa release, and this is the residual body, which is like type of like part of cytoplasm, which is like discarded part. Okay. And here we can see the parts of the spermatozoa. Here we can see the acrosomal cap. We know about the acrosomal cap. The nucleus of the cell is now big part of the head of the spermatozoa. The centriole is making the neck. Also, it is making the tail here. Okay. The spiral mitochondria is making the middle piece. The spiral mitochondria is making the middle piece. Yes, clear? Now, if this diagram is given to you and it is asked what is this step taking place, we can say that this is the round spermatid, and slowly we can say there is change in shape and rearrangement of the cell organelles. Do you appreciate? The spiral mitochondria are moving, the Golgis are moving, and finally they are making the acrosomal cap here. And this is the spiral mitochondria. They're finally becoming the spermatozoa. So this step that is taking place is spermiogenesis. Okay, from spermatid to spermatozoa. Is that clear? Yes? Is it clear? Can we proceed? All right. Let us have a very quick review on this pathway. Okay, and then we will begin with the oogenesis. So I told you the epiblast makes the primordial germ cells in the second week. Okay, in the second week. And these primordial germ cells will start migrating. First they reach the wall of yolk sac, then they reach the developing gonad. Okay, then they reach the developing gonad. Here they are called as Spermatogonia or the oogonia in male or female. Now we started in the male, we looked at the steps of spermatogenesis. Now Spermatogonia, they will undergo mitosis, they will increase in number. Okay, they'll keep on increasing in number, but few cells are now ready to undergo meiosis. Those cells are called as primary spermatocyte, which will undergo meiosis 1 to make the secondary spermatocyte. This step is called as stage of independent assortment of chromosomes, and the meiosis 1 is working on the number of chromosomes. Meiosis 2 was working on the amount of DNA. It is going to make the spermatid. Okay, and after spermatid formation there is a step called as spermiogenesis. In this spermiogenesis, these are the important events taking place which will eventually make the spermatozoa, and once the spermatozoa is formed, it will be released into the lumen. The step is called as spermeation, right? And after this is released, they are taken to the epididymis by the muscular movement of the tube, and for storage and maturation. These are important questions. Although they are said to be mature, they are not mature enough to carry out fertilization, which is actually taking place in the female genital tract. And what was the name of the step? That is capacitation. And what part of the female genital tract contributes most? Fallopian tube. And what is the time required for the capacitation? 6 to 8 hours. Average is taken as 7 hours. And time required for spermatogenesis is 74 days. Yes, everything clear? All right. All right. Very good. Now let us see what is the, time for spermatogenesis. When does spermatogenesis take place? The spermatogenesis takes place in at the time of puberty. See, what we have learned that in case of developing baby, in the intrauterine life, okay, the epiblast has made the cells, primordial germ cells, then they were converted into spermatogonia in the developing testes, in the developing seminiferous tubules. Fine. But then they rest there. They don't undergo further any division. All right. They don't form anything. They simply rest until the puberty. At puberty, hormonal changes take place. Okay. And then they begin the process basically. So we can say the spermatogenesis begins at puberty. But that is not the case of oogenesis. In case of oogenesis, that means in case of female, what happens? The cells, primordial germ cells, just like in case of male, they have also reached their gonad, that is in the developing ovary. But unlike the cells in the male which were resting, in case of female, these cells will not rest. They will start dividing. That means they will reach some stage of oogenesis, and then there is a rest. Okay, so now when we will be looking at the steps of oogenesis, we will be comparing both the the processes, the spermatogenesis and the oogenesis. All right, now let us write down the last line here, that what was the time for spermatogenesis. The spermatogenesis begins at puberty. It begins at puberty. Fine. Now let us look at the oogenesis process. Let us now look at the oogenesis process. First point, it begins in intrauterine life. As I told that it will not rest. It begins in intrauterine life, but then there is arrest. So it is resumed at puberty, not begin. Okay. At puberty, there will be hormonal changes. Again, it will be resumed at puberty. So that is the first difference. First difference lies in the timing of the events. Okay. So the oogenesis begins in the intrauterine life and resumed at puberty. Spermatogonia only. Okay. So in case of male, they remain as spermatogonia. Okay. And in case of female, now they will begin, because in case of male, they don't begin, they simply rest. Okay. Now what happens in case of female? To start with, again the same similar cells are oogonia. Fine. They will undergo mitosis. Yes. What will happen after mitosis? The number will increase. The number will increase. So there is increase in number. Fine. Now few cells will want to keep on increasing the number, but then there are few cells which want to further undergo meiosis 1. So what will happen here? There will be few cells which are now primary oocyte. Now this primary oocyte, which is now ready for undergoing meiosis 1. Yes. Now it is ready, so it will undergo meiosis 1. And as we have seen previously, oogonia are diploid. Primary oocyte is also diploid. Meiosis 1, which is reduction division, should yield what? It should give us the secondary oocyte, which should be haploid in number, isn't it? But what happens really? There is a arrest here. There is arrest in dictyotene stage. Of prophase 1, in dictyotene stage of prophase 1. Okay, there is arrest in dictyotene stage of prophase 1. Okay, now the question is, in like embryology books it is written as diplotene stage, and in case of like gynae books it is written as dictyotene stage. Actually the same thing, only the name is different, so better to go with the one terminology. Better is to write dictyotene stage only. So there is arrest in the dictyotene stage of prophase 1. Okay, now what happens next? This is all happening in the intrauterine life. That means the female baby is in the womb of the mother. She herself is not delivered. Do you understand? But inside, her body is making the cell which is required for her further next generation. Are you understanding? So basically that is not the timeline for it to happen now. So basically the nature says that, okay, you take rest now. And there is a arrest that is designed by the nature. And what will happen next is there will be birth of the baby. That means you can say at the birth of the baby, this stage is maintained. This stage is maintained. That means primary oocyte in the stage of arrest is there. That means we can say in case of female, whatever number of oogonia were there, all have reached this stage at the time of birth. Okay. So at the time of birth, this is the stage which is maintained. Then there will be childhood. The baby will grow. And in the childhood also this stage is maintained. Same thing. Nothing, no change. But then comes the puberty. Then comes the puberty, and because at the puberty there will be hormonal changes. Okay, for the puberty there will be hormonal changes. Now this hormone comes, that is LH surge. LH surge will break the arrest. LH surge will break the arrest, and because of LH surge the meiosis 1 completes. Meiosis 1 completes. Because meiosis 1 completes, there is formation of what? There is formation of secondary oocyte, and secondary oocyte is haploid in number. Plus there is formation of first polar body. Now polar body is again a different from the spermatogenesis, because we don't have any polar body in the spermatogenesis, right? Now secondary oocyte, which is formed here, will enter again into, just after formation it will enter into meiosis 2. Just after formation it will enter into meiosis 2. Fine. Now what is the fate of this cell after meiosis 2? There is again a rest. There is again a rest. So now there is a rest in the metaphase of meiosis 2. You understand? So basically there is second arrest now. And if you look at the arrest stages, first arrest takes place after in the first meiosis, in the first phase, that is prophase. Okay. So first arrest, first meiosis, first phase. Second arrest, second meiosis, second phase. So second arrest takes place in the metaphase of meiosis 2. Is that okay? Yes. Now what is the fate of the secondary oocyte, which is again in the stage of arrest? This arrest will be broken, or you can say meiosis 2 completes. Meiosis 2 completes only if there is fertilization. Meiosis 2 completes only if there is fertilization. Yes? And then there will be release of the second polar body. All right? This step is clear. The oogenesis. Yes? Now let me show you how it is happening in the female. Right? So this is the section of the ovary, and here we can see first thing, that is the lining epithelium is called as the germinal epithelium, which is a misnomer because the germ cells are not taking origin from here. This is simple lining epithelium. Okay, so we call it as germinal epithelium, which is misnomer. First thing. Second thing, we can see here there are follicles present. We have follicles present in the different stage of development. Okay, in the different stage of development we can see the follicles are present. All right. Clear? Now how these follicles are formed, let me describe this. Okay. See, in the fourth month, or you can say in the very early stage in the intrauterine life, okay, the cells which have reached here, the oogonia. We know the oogonia are those cells which are primordial germ cells which have reached the ovary, developing ovary. Now ovary, what ovary will do? ये जो सेल बाहर से आ रहे हैं, ओवरी के जो सरफेस एपिथेलियम के सेल्स हैं, बाहर से आने वाले सेल्स का क्या करेंगे? ये उनका स्वागत करेंगे. स्वागत कैसे करेंगे? स्वैग से स्वागत करेंगे. स्वैग से स्वागत कैसे करेंगे? ये उनको ग्रुप्स में रैप कर देंगे. ठीक है. अब how it is going to happen, we can see the flat epithelial cells, they are wrapping around a group of cells. Inside we have the oogonia, outside lining cells are the flat follicular cells. Flat follicular cells कहाँ से आए हैं? Surface epithelium से. और अंदर के oogonia कहाँ से आए हैं? वो travel करके आए हैं जो हमने starting से पढ़ा था. Are you understanding this much? Yes. Now initially the resources were less for the ovary, so they were wrapping the groups, but slowly they have more resources. Now what they are going to, what are they going to, mm, what are they going to do? They are going to basically wrap the individual cells. Individual cells, we have the primary oocyte. Primary oocyte in prophase is there, है ना? And outside we have one, the cell is there. So basically earlier एक group में एक इनका group बना के रैप किया था, बाद में individual cells को रैप किया हुआ है, ठीक है? Now this is a unit. That means inside we have the primary oocyte surrounded by the flat follicular cells. So inside we have one oocyte in the stage of arrest, and outside we have the surrounding cell. This becomes a unit. What is the name of the unit? Primordial follicle. What is the name of the unit? Primordial follicle. Is that okay? Yes. Is that okay? यहां तक समझ आ गया आपको? प्राइमोर्डियल फॉलिकल कैसे बना? यहां तक समझ आ गया? ठीक है. इसका मतलब ये है, न्यूबॉर्न बेबी में दो ओवरी है. Both the ovaries are now loaded with primordial follicle. And in the primordial follicle structure, we have primary oocyte in the stage of arrest surrounded by the flat follicular cells. And this stage of primordial follicle, with the primary oocyte is maintained in the childhood. Okay, till puberty it is maintained. What will happen at the time of puberty? First, the hormone which will bring the change is FSH. What is the full form? Follicular stimulating hormone. So obviously we have a pool of follicles in both the ovary. FSH is coming. What is its role? Follicle stimulating. It will stimulate the follicles. Yes. But the amount of FSH released in each cycle is not sufficient to stimulate all the follicles in the both ovaries. Yes. So it could stimulate only 15 to 20 follicles. So which 15 to 20? That is purely random basis, either on the left ovary or on the right ovary. And again, there is a pool of follicle on the random basis. Those will be selected. Those random selected 15 to 20 follicles will start growing under the influence of FSH. Are you guys understanding this? So 15 to 20 follicles will start going. 15 to 20 follicles will start growing under the influence of primordial follicle. So this is the primordial follicle. Let me repeat. The primordial follicle is what is having the primary oocyte surrounded by the surface epithelial cells, flat cells you can say. Then they start growing. When they start growing, the change that is going to take place is basically more on the surrounding cells. It is more on the surrounding cells. So what will happen? The surrounding cells will become cuboidal from the flat. They become big and cuboidal, and then they become multi-layered. This many layers have come there. Is that okay? Yes. And the most important event, these surrounding cells and the inside oocyte, both of them, they are going to secrete a layer around the oocyte, which is a red colored layer here. Not actually red color, means it is shown in the diagram, right? That is zona pellucida. What is zona pellucida? It is a glycoprotein layer. Okay. So this is first seen in the primary follicle. What happens next? The primary follicle will develop into secondary follicle. And what happens in the secondary follicles? The surrounding cells are growing very fast. They're growing very fast rate. Yes, when this is all happening, there will be development of a cleft, a gap create हो जाएगा, है ना? इस cleft को बोलते हैं antrum. As soon as this antrum develops, it is called as secondary follicle. From primary follicle, it has become secondary follicle. ठीक है? And secondary follicle is also called as antral follicle. Then the antrum will start growing in size, so much so that the oocyte is now present only at a disc-like site here. This disc-like site of attachment is called as discus proligerus. What is the name? Discus proligerus. And now the cell, primary oocyte, is surrounded by very few cells, which is called as cumulus oophorus. Okay. Earlier, the primary oocyte is surrounded by so many number of cells we can see here. but as the antrum is growing, it will make the primary oocyte to be attached on a disc-like small site on in the periphery, which is called as discus proligerus, and the surrounding cells are also reduced in number, which is called as cumulus oophorus. Okay, this stage is called as Graafian follicle. Okay, and after that, LH surge will come, ovulation will take place. This primary oocyte, okay, in primary oocyte will immediately, you see, just at the time of ovulation, it will divide and it becomes secondary oocyte. It will immediately divide and it becomes secondary oocyte, and secondary oocyte is the one which is ovulated. Secondary oocyte in rest is the structure which is ovulated. Is that okay? Yes, clear? So this is our primary oocyte in division. Now this has become the secondary oocyte and one polar body is released. This is the structure which is released. This is the structure which is ovulated. Okay, when we say ova is ovulated, what is ova? Ova is a layman term. In embryology or medically, if we talk about the term, it is a secondary oocyte in division which is ovulated. Is that okay? Yes. Now, when this is ovulated, this is surrounded by the cumulus oophorus cells. Yes, these are the granulosa cells. Yes, and these cells will now rearrange themselves in the form of sun rays. That means we have the oocyte here, we have the oocyte here, and the oocyte is now surrounded by the cumulus oophorus cells. These cumulus oophorus cells are rearranging themselves in the form of sun rays like this. This is called as corona radiata. Corona radiata literally means sun rays. So these sun rays are what? These are corona radiata. Okay. Yeah, follicles will be selected purely on the random basis. Okay. I told you, na, it's purely on the random basis. It is not fixed like left ovary or the right ovary like that. It's not like fixed. Okay, so corona radiata is nothing but the sun rays. The which cells are arranging as corona radiata? These surrounding cells, cumulus oophorus cells, which are ovulated along with the oocyte. Okay, is that clear to everyone? Please give me the feedback. Is it clear? And let us write down the notes quickly, what we have learned. Okay, so we have learned this much, that the steps of the oogenesis. Let us write down about the follicles. Okay, so at the time of birth, primary oocyte surrounded by flat epithelial cells is called as primordial follicle. Okay, now the pool of primordial follicle is there. The primordial follicle, pool of primordial follicles are there. Okay, under the influence of FSH, under the influence of FSH, 15 to 20 primordial follicles will become primary follicles. 15 to 20 primordial follicles will become primary follicles. What are the changes? The surrounding cells become multi-layered, and cuboidal, and the important change, that zona pellucida is formed. Zona pellucida is formed. This is again an important question. The zona pellucida is first seen in, answer, primary follicle. Okay. Now from these primary follicles, they will keep on growing and they will make the secondary follicles. How many secondary follicles will form? How many secondary follicles will form? All 15 to 20 will reach the stage of secondary follicles. All 15 to 20 will reach the stage of secondary follicles, and in the secondary follicles the antrum is formed. Okay, after secondary follicles, there is formation of Graafian follicles, and the Graafian follicle, how many? Only one. One Graafian follicle will be formed, or pre-ovulatory follicle or mature follicle. And what happens here? Here we have two important things to discuss. One is discus proligerus. What is discus proligerus? It is the disc-like site of attachment. And second thing is cumulus oophorus. What is cumulus oophorus? These are the collection of small cells which are still surrounding the oocyte, which will eventually be converted into the corona radiata. Is that okay? Yes. Now from the Graafian follicle, the oocyte will be released. There will be ovulation. There will be ovulation. And we have the secondary oocyte surrounded by corona radiata. This is secondary oocyte and these are corona radiata. Okay, and here we have one layer. What is this red color layer? The red color layer is zona pellucida. Do you appreciate? So we have the corona radiata, then zona pellucida, then we have the ovum. Is that okay? Yes. And when the spermatozoa are coming, first layer they have to cross is the corona radiata, then they will approach the zona pellucida. Is that okay? Yes. Are you guys done up to this? Have you understood? All right. So let us take one question and then let us see how the fertilization takes place. Okay. Let us take this question. The cells which surround the oocyte in the Graafian follicle are called. What is the answer? Straightforward question. Answer is cumulus oophorus. Answer is cumulus oophorus. And we know the term discus proligerus is the site of attachment, disc-like site of attachment for the oocyte. Is that okay? So these two terms are important here in the Graafian follicles, right? Now, let me describe the stage of fertilization. What happens here? Please be with me, understand. As I told you, the spermatozoa, so many spermatozoa are coming and they are reaching the site of fertilization. What is the site of fertilization? Ampulla of the fallopian tube, right? Now this spermatozoa will first cross the layer of corona radiata. After corona radiata is done, they will reach the zona pellucida, and zona pellucida is a glycoprotein membrane. Now the spermatozoa, it will release the acrosomal content here, and the acrosomal content is nothing but the hydrolytic enzymes, and hydrolytic enzymes will dig a pore in the glycoprotein layer in the zona pellucida. This reaction is called as acrosome reaction. What is that? Acrosome reaction. Please understand. Once the acrosome reaction is there is a hole in the zona and the spermatozoa is entering. The spermatozoa is entering here. You can see the spermatozoa is entering. It is going deeper and deeper, and it has now approached the cell membrane. Do you appreciate? If you pay attention here, just below the cell membrane, we have the cortical granules present. Yes. Now this spermatozoa, once it has approached the cell membrane, it will try to penetrate the cell membrane. Yes. And as soon as the penetration is done, these cortical granules adjacent to it will start releasing their content. These cortical granules will start releasing their content. This is called as cortical reaction. What is the importance of this reaction? This content will be sensed by the zona pellucida. And as soon as the zona pellucida senses the contents here, that means now zona is aware that because the content has come, that means the penetration has taken place. That means the fertilization has already taken place. Means what should I do? I should change my configuration and I should not allow second spermatozoa to enter. So now the zona won't allow the second spermatozoa to enter. That means what is the role of zona pellucida? It will prevent polyspermy. It will prevent polyspermy. And what is the order of the reaction? First was the, you see, corona radiata, then acrosomal reaction, then cortical reaction, and then zona reaction. Is that okay? Yes. Now based on these facts, and then you see there is fertilization, है ना? This is how it is happening. See, we can see here that we have the spermatozoa coming. Both, so many spermatozoa are approaching, and one of them is succeeding here. See, this is so wonderful that one of them, after all odds, है ना, this spermatozoa has won the race, right? And this is nothing but all the living individuals. All the living individuals have already won the race, isn't it? So this is so wonderful to know that all of us, we have competed one race in the in the time that we are not aware, isn't it? Now you see, this is male pronucleus, female pronucleus, this is all happening. And then the zona, when the zona is changing its configuration, there will be some spermatozoa who are trying to penetrate, who are partially embedded. They are in different stages. What zona will do? Zona will change the configuration, will not allow second sperm to enter, and it will kick the partially embedded sperm out. Okay, those who are partially embedded will be simply kicked out. So no second sperm can enter. Now they will start developing, they will start dividing, and once they start dividing, it becomes the zygote, right? This is how it happens. This is the fertilization. I hope the gametogenesis and the fertilization is clear to you guys. Tell me quick feedback. Is the gametogenesis and this fertilization, is it clear? Yes? Now let us take this question. Choose the correct sequence of the following embryonic event. So choices are cortical reaction, zona reaction, acrosome reaction, and the penetration of corona radiata. As we know, penetration of corona radiata will be the first thing to happen, isn't it? And after penetration of the corona radiata, the sperm will approach the zona pellucida and will release the acrosomal enzyme. So the next to happen is acrosome reaction. After that, the cortical granules will release the content. So next to happen is the cortical reaction, and after cortical, the last will be the zona reaction, which will prevent the polyspermy. So answer to this question is 4, 3, 2, 1. That is penetration of the corona radiata, then acrosome reaction, then cortical reaction, and finally zona reaction. Is that okay? Is it clear now? Yes? All right. Now there is one very important thing that I would like to show you now, that I started the discussion with the primordial germ cells, and I told you that primordial germ cells will reach the developing gonads. Yes, everyone has understood this much. Sometime it happens that the cells got deranged. Then what will happen? In case of primordial germ cells, some cells are deranged, they are like lost or somewhere, they are going to make oropharyngeal teratoma. They are going to make oropharyngeal teratoma. Oropharyngeal teratoma. Is that okay? Are you understanding this? Oropharyngeal teratoma. And why this is teratoma? It is having the derivatives of all germ layers. Then why from the primordial germ cells? See, the primordial germ cells are eventually going to make the gametes, which will eventually make the whole individual, isn't it? So they have the capacity to make the derivative of all germ layers. That is why once they make the tumor, this is of teratoma type. So remember, primordial germ cells, they must reach their destination, that is fine. If they are deranged, they may form oropharyngeal teratoma. This is a clinical application here, and now the trend is more of clinical integrated teaching and the clinical integrated questions being asked in different exams. So this is particularly important for the central exam. Is that okay? Yes. Let us take this question. Oropharyngeal teratoma may arise from PGCs or from epiblast cell. This is the assertion. Reason: PGCs or epiblast cells are pluripotent. Tissues within these tumors include derivatives of all three germ layers and may include gut, bone, skin, teeth, etc. Whenever you get a question on assertion and reason type, consider both assertion and reason as a separate statements. They may or may not be related. Okay, they may be true, they may be false, or one may be true, one may be false, or it may also happen so that both are true statements, but the reason is not the correct explanation. Is that okay? So this is how we should keep in mind while solving such questions. Now, looking at the statement A, oropharyngeal teratoma may rise from PGCs or epiblast. That is true statement. Reason which is given here is PGCs or epiblast cells are pluripotent tissues within these tumors. Tissue within these tumors include derivatives of all three germ layers and may include gut, bone, skin, teeth, etc. That is again true statement. Both A and R are true, and R is the correct explanation. Yes, the answer to this question is A. Answer to this question is A. Both are true and R is the correct explanation of A. Okay. This is exactly how we have to solve. All right. So I hope everything is clear to you guys. Right. This is my number. In case of any doubt, feel free to ask. In future also keep following the demo lectures. Thank you everyone.